morning dear friends and students. Today we are going to discuss about fetal skull. It is very important for nursing students, those who are going to appear obstetrical and gynecological practical examinations. Before going for the practical demonstration, we have to know about fetal skull. Fetal skull is the most difficult part of the baby to come out through the maternal pelvic canal. Understanding the anatomy and measurement of various parts of fetal skull helps to determine whether a normal delivery or a cesarean section will be suffice. Next, let's go for fetal skull divisions. It is divided into vault, base and face. This is vault, this is base and this is face. Bones of the fetal skull include occiput, 2 parietal bone, 2 temporal bone and 2 frontal bones. Next is the sutures of fetal skull. There are 4 sutures are there: lambdoid suture, sagittal suture, coronal suture and frontal suture. In that, first one is lambdoid suture. It's form the junction between occipital and parietal bone. This is occiput and this is parietal bone. Suture between the junction is called lambdoid suture. Next is sagittal suture. This is the suture joins 2 parietal bones together. Suture between 2 parietal bone. Next is the coronal suture. The suture joins the frontal bone to the parietal bone. Next is the last suture, frontal suture. Suture, it joins 2 half of the frontal bones. There are 2 fontanelles are there, anterior fontanelle and posterior fontanelle. Anterior fontanelle, also called brecma. It is found at the junction of sagittal, coronal and frontal suture. It is a broad kite shape and it is measures 3 to 4 cm long and 2 cm wide, and it is closest by 18th month. This is anterior fontanelle or brecma. It is in diamond shaped or kite shaped, the junction between coronal, parietal and frontal suture. Next is posterior fontanelle. It's also called lambda. The junction of the lambdoidal and sagittal sutures. It is a small triangular in shape and normally closes by 6th weeks. Here we can see the triangular shape, the junction between the lambdoid suture and sagittal suture. Then shall we move to the diameters of the fetal skull? First one is suboccipito-brecmatic. Suboccipito-brecmatic, that is 9.5 cm. Then suboccipito-frontal diameter, that is 10 cm. Then the occipito-frontal diameter, that is 11.5 cm. Then the mento-vertical diameter, it is the largest diameter of the fetal skull, that is 13.5 cm. Next is submento-vertical, submentum to vertical line, that is 11.5 cm. Is submento-brecmatic, submentum to brecma, that is 9.5 cm. Next is the biparietal diameter, parietal bone to parietal bone, that is 9.5 cm. Next is the last diameters of the fetal skull, bitemporal diameter, temporal bone to temporal, that is 8.2 cm. Dear friends, through my presentation, I think you got some idea about fetal skull. Thank you all for watching my video. Once again, thank you all. Have a nice day.